We will be starting momentarily. Please hold just one additional minute. Good evening, everyone. Thank you so much for joining us this evening. We were waiting to allow a lot of the participants to join in, as we have a lot of participants registered for this webinar. Thank you so much for your patience. I'm Elvidge Proctor, Director of Health Policy at Lung Cancer Alliance, and I welcome you. Again, I just want to thank you for joining us this evening. I just want to tell you on behalf of Lori Fenton Ambrose, our President and CEO, that each and every single one of you inspire us by your courage and your strength. You are all making a powerful statement just simply by registering for this National Advocacy Summit, and your willingness to travel far from home to come to Washington, D.C. certainly will bring hearts and minds to those living with lung cancer. And personally, I just want to let you know, I've heard from so many of you, and I truly do understand the sacrifices you are making on behalf of the lung cancer community, just demonstrating your commitment to us and to the cause. And again, we just want to thank you and welcome you to what we hope will be an informative and a most enjoyable evening. As we are ready to start, just wanted to be able to introduce to you that tonight we will be joined by several of team members from the Lung Cancer Alliance. This call is being recorded, and we would like to be able to share the recording with those who are missing tonight's presentation. Thank you so much. We are adapting to a new system, and we are able to be on live, and I hope that everyone can see the screen. Just some real quick housekeeping. If for one reason or another you've lost contact with us, just try to log back on. If you need to reach us, feel free to send an email to the policy@lungcanceralliance.org. In order to be able to ask your questions tonight, you will have to access the feature on the upper right-hand corner of your screen, which will be a very small but red arrow. Once you click on that arrow, it will open up the question or chat box where you will then be able to type in your questions. For this call, because it's being recorded, everyone is on mute. And again, you can ask your question through the question box or simply emailing policy@lungcanceralliance.org. And again, we ask that you take notes on the information being presented, and feel free to ask your questions at the end of the session, as well as in the days to come. We look forward to hearing from you. As we begin, I wanted to share with you a very brief background about myself. What I want you to walk away with is the fact that throughout my career, I worked very hard to raise awareness and engage members of Congress on disability issues. I truly do understand the reasons that prevent individuals from being heard, and that is why I choose to advocate for the lung cancer community. I would like to be able, again, to review with you what that question box looks like, just so that anyone who is having trouble finding it, it's at the upper right-hand corner of your screen. You're going to see it, an arrow pointing towards the left side, and that's where the question box is. We will allow 15 minutes for Q&A at the conclusion of this presentation. What we do at Lung Cancer Alliance, Our health policy is simply about advocating for a more coordinated, comprehensive, and compassionate federal plan of action that addresses all aspects of lung cancer. We want to be able to link prevention, early detection, and treatment research together in the full continuum of care. This National Advocacy Summit is really about coming together. It's a national call to action. It really is the best opportunity to engage you, the individual constituent, the voting member of members of Congress. It is about engaging you in direct advocacy as we further our mission of empowering those living with and at risk for lung cancer. It is bringing our community together so that we share perspectives on healthcare, research, and best ideas for federal funding and taking that to your members of Congress. It is really about questions, concerns, and solutions to our problems, what we see as issues in the lung cancer community. Lung Cancer Alliance is working hard to raise awareness. We're also working to dispel the myths about lung cancer. It is together that we can fight to end lung cancer, and we can fight for each and every member, those that are here that will be represented in Washington, and those that will be back at home in the States. The opportunity on September 28th is an extraordinary opportunity for you as an individual to come face-to-face to meet with your members of Congress and to make your ask. We would like to guide you in what to ask your members of Congress. Number one, there are opportunities for members of Congress to come together on issues of shared interest. We have the bipartisan Congressional Lung Cancer Caucus, and that is made up of members of both parties, Republicans and Democrats alike, who have stated that they would like to come together and join efforts in addressing lung cancer. And so you can make an ask for them to join the bipartisan Congressional Lung Cancer Caucus to show their support on our issues. The second ask that you can make is approving increasing funding and support for cancer and lung cancer specific research. The third ask that you can make is regarding health care. We all want Congress to focus on improving health care with the strongest patient protection. And this conversation is timely as Congress is debating health care right now. Our health care delivery system is being looked upon in terms of how to improve it and what changes are right for patients and families and Americans. We must weigh in. We must be a part of that conversation. But in order to do that, we have to understand what's at stake. So I want to just briefly touch on our pillar of access to care, because for years, Lung Cancer Alliance has addressed the issue of access to care in terms of bringing about early detection. Lung cancer screening, as you know, has been a covered preventive service with no cost sharing under the Affordable Care Act. It took well over 10 years to make early detection screening a public health priority. And right now, in terms of what's being proposed, right now, this life-saving achievement could be at risk. We need you, and we all must play our role in advocating for improving equitable access to high-quality, affordable care right now. And to help us to understand where this debate stands currently, I have invited Katie Garfield, who is a staff attorney at the Center for Health, Law, and Policy Innovation of Harvard Law School, to join us in a conversation tonight. And Katie's going to share with us just current updates or insights that she has on the health care bill. And this will come back to relate to what we will address when we go on Capitol Hill on September 28th. Katie, I welcome you to please join us.
Hi, this is Katie Garfield. So first I wanted to start by saying thank you, Elridge, for that introduction, and by thanking all of you for everything that you're doing to really give a voice to individuals living with lung cancer. As Elridge mentioned, I am a staff attorney here at the Center for Health Law and Policy Innovation. So just to give you a sense of what that means, our center is a health law and policy clinic of Harvard Law School. So that means we're both an academic program involved in teaching Harvard Law students, and we're a health law and policy think tank that works with organizations sort of across the nation, including Lung Cancer Alliance, to help them navigate the health law and policy landscape. As I'm sure you're aware, that health law and policy landscape has been really pretty rocky over the last few months. So my role today is to give you an update on the ongoing efforts to reform our national healthcare system and give you a sense of how those efforts could impact specifically access to care for individuals living with lung cancer. So let's begin with the sort of million-dollar question, which is, where are we now? As I'm sure you've been seeing in the news, Congress has really spent the last several months trying to pass legislation that would drastically change our healthcare landscape. Specifically, they've been making proposals that would repeal and replace a lot of the Affordable Care Act, which I'll just refer to as the ACA, and also legislation, that same legislation would fundamentally change the way we pay for Medicaid, so that our nation's healthcare safety net for low-income individuals. So those efforts, just to give you a bit of history, really came to a head this past July when the United States Senate voted against moving forward on any of the existing ACA repeal and replace proposals that were available at that time. And since that time, there's really been a lot of uncertainty about what Congress would do this fall when it returned to D.C. from its sort of August recess. Ultimately, there's probably three real potential outcomes here. First, there is still this threat, this possibility that the Senate will revive its efforts to repeal and replace the ACA. I'll say, to be really upfront, I think this option is looking increasingly unlikely given the lack of sufficient support in July and the fact that Congress would actually have to complete these efforts by the end of this month due to some of the congressional rules around the reconciliation process they're trying to use. However, I would say it's not out of the question that it could occur. The White House really continues to provide a lot of support to returning to repeal and replace. And in fact, we really did just see a bit of a revival of these repeal and replace efforts today when Senators Lindsey Graham and Bill Cassidy introduced a new bill that would focus on repeal and replace, that does a lot of the same things that the proposals we saw over the past few months also would have done. So again, raising some similar threats to access to care. Second, if we don't see repeal and replace really move forward and get finalized this month, we may instead see, and we're already starting to see some of this, a coming together of Republicans and Democrats to try and develop some bipartisan health care legislation. These are really, these ideas are recognizing the fact that the Affordable Care Act did a lot of really helpful things in improving access to care, but it's not by any means a perfect law, right? And so there are some Republicans and Democrats that are currently trying to work together to largely preserve the ACA, sort of try and preserve all the good things it's done, but then build upon it to address some of the issues that are, for example, making Affordable Care Act plans unaffordable in certain areas of the country. So we may also see that kind of bipartisan movement going forward that will be sort of more targeted, smaller changes to the way the ACA works. And finally, we may not see any legislation. So Congress may ultimately not pass any new healthcare legislation really looking to overhaul the ACA. In that case, I think what we'll see is more activity at the state level with states going ahead and seeking waivers to try and change the way that the Affordable Care Act is implemented sort of more locally. So to start with, I'd like to say that really regardless of which of these three paths Congress ultimately chooses, the key message for you as an advocate for individuals living with lung cancer really remains the same. And that message is that the need to protect and improve access to care. So, you know, if legislators move forward with repeal and replace efforts, it's still important that they do so in a way that preserves access to care. Similarly, if we see sort of a bipartisan legislation that's looking to sort of build upon the ACA or do more targeted changes, that should still be done with an eye towards protecting access to care. And finally, even if no legislation occurs, if instead you're seeing action at your state level through things like waivers, again, it's so important that those policymakers are keeping in mind the types of protections that individuals need to really access care. So again, a lot of different possible outcomes, but really the message is the same: protect and improve access to care. So before we sort of dig into some of those protections, let's start by defining what we mean by access to care, as that's going to help us think about the types of protections that are important to the concept of protecting access to care for individuals living with lung cancer. So when we talk about access to care, we really kind of mean three things. So true access to care means access to health insurance coverage that first doesn't exclude individuals based on health status. Second, includes access to necessary services. And third, is affordable. So on this slide, you see a quick overview of some of the existing protections in our national healthcare system that ensure access to care. And they're sort of broken down by these three categories, right? So needing access that doesn't exclude individuals. So that's really access to coverage. And the protections we have there under the ACA include things like pre-existing condition protections. Then we have, again, making sure you have access to necessary services. So our current healthcare system includes requirements that ensure access to necessary services, like the essential health benefits requirement and requirements related to preventive services. And then finally, to ensure affordability, our national healthcare system provides subsidies to individuals who struggle to afford coverage on the individual market. And when I talk about the individual market today, I mean the state exchanges, the places that individuals can go to buy plans if they don't have health insurance through an employer or through a public program like Medicaid or Medicare. And that's where in the past, before the ACA, there were a lot of affordability problems. So we know that a lot of the protections, including subsidies, you see those on the individual market to ensure affordability. And then the other major sort of protection from an affordability standpoint for our lowest income individuals in the country, of course, would be Medicaid. So again, that safety net system for extremely low income individuals. So basically what we're saying is when we're saying we need to protect access to care, we're really saying that Congress should really consider this landscape of protection and how they can preserve and build upon those protections moving forward. So now we're going to take a closer look at those protections and what they would mean for individuals living with lung cancer. So first, for individuals living with lung cancer, it's important to have access to health insurance that can't exclude you based upon a lung cancer diagnosis, right? Or any other health condition. So under the Affordable Care Act, individuals living with lung cancer are protected from this type of discriminatory approach through a series of protections that are aimed at all individuals living with pre-existing conditions. And there are, so first, the ACA prohibited insurers offering plans on that individual state marketplace I mentioned from refusing to cover someone based upon a pre-existing condition or charging someone more for coverage based upon that condition. And we call these two requirements guaranteed issue and community rating. So guaranteed issue, we're guaranteeing that we're providing coverage regardless of your past health conditions. And community rating means we're going to charge you the same as other similarly situated people in your community, right? We're not going to charge you more just because you have a pre-existing condition. So, and as you can see from the example on this slide, it's really important to have both of these requirements in place, right? So without guaranteed issue, so that requirement to provide coverage, the person on the left might have coverage while the person on the right is excluded from coverage due to their health condition. In contrast, without community rating, so that provision around charging the same amount, both the person on the right and left might both have coverage, but the person on the right could be charged so much more for that coverage that they couldn't really access care, right? So these are really both two important protections that we have in place and that have been somewhat at risk over the course of this repeal and replace discussion. And then second, we know that the Affordable Care Act also prohibited all plans, including employer plans, from using waiting periods to delay coverage for services related to pre-existing conditions. This prohibition ensures that individuals living with conditions like lung cancer can immediately access and afford the care they need. And as you can see, losing any of these protections could have a really significant impact on anyone living with a pre-existing condition. Second, as we said, it is important for individuals living with lung cancer to be able to access health insurance that covers the services that they need to really thrive. So the ACA protected access to key services in a couple of really important ways. We already talked about this a little bit at the start of this webinar, right? That first, it established that all commercial plans, including employer plans, and some Medicaid plans, must provide coverage of certain preventive services at no cost to the patient. So no copay, no co-insurance, none of that. You have to provide these certain preventive services. And as Elridge mentioned at the start of the webinar, those preventive services include access to low-dose CT scans for lung cancer screening. So that service that can make such a huge impact on really the outcome for somebody living with lung cancer, how quickly it's able to be caught. And then second, another really important protection from an access to services side is that the ACA required that plans sold on those state exchanges and certain Medicaid plans cover 10 categories of care that we call essential health benefits. And these categories include services that are really crucial for effective treatment and prevention of lung cancer. So you can see those services listed on the right side of the screen here with a couple of key ones sort of highlighted. So essential health benefits include things like prescription drugs, inpatient and outpatient care, and preventive services. So this essential health benefit in these plans reinforces that broader requirement that all of these plans are required to cover preventive services like lung cancer screening. So these requirements really build upon the pre-existing condition protections by making sure that individuals not only have access to a health plan, but that health plan actually covers the basic services they need for care, right? Because access to a health plan in and of itself doesn't mean isn't enough, right? It also has to be a robust health plan that covers the things that you need. And so to protect access to care, and again, necessary to protect some of these provisions around access to services. And then third, again, to have true access to care, individuals living with lung cancer or any, a chronic illness or a serious illness really have to be able to make sure they can afford the care that they have. So currently, our healthcare system has two ways that it attempts to ensure that coverage is affordable. And I mentioned these a little bit at the start. First, on the individual market, so on those state exchanges, it provides subsidies to help individuals afford plans on their exchanges. And second, it provides funding for Medicaid, our safety net health insurance program for particularly low-income individuals. So let's sort of break those two out. To keep access to coverage really affordable on the state exchanges, the ACA established two types of subsidies. First, we have the advanced premium tax credit. So those are tax credits that help individuals afford their monthly premium when purchasing coverage on the state exchanges. So that amount that you're paying every month, really trying to keep it in an affordable range. And then we have the cost-sharing reduction subsidies. So these are subsidies that help particularly low-income individuals to afford their out-of-pocket costs. So those are those costs for care that are on top of your premium, your co-pays, your co-insurance, your deductible. So for individuals living between 100 and 250% of federal poverty level, there's additional subsidies to help them pay for those costs. Again, if you're purchasing on the individual markets, which are the state exchanges. And so, like many of the protections that I've mentioned throughout this presentation, these protections could be at risk if legislators move forward with some of the proposals that are discussed this summer, and also very specifically the proposal that was introduced this morning would put some of these affordability provisions at risk. For example, the cost-sharing reductions could be eliminated, and the advanced premium tax credit could either be eliminated or, depending on the proposal, restructured in a way that might make them less generous, particularly for low-income older individuals. I'm sorry, there seems to be one slide missing, but I'll just fill it in here. For many low-income people, access to affordable health insurance actually means access to Medicaid programs, right? So those programs that provide coverage to low-income populations with little or no cost-sharing or monthly premiums, so that cost doesn't prevent these individuals from accessing care. Currently, the Medicaid system is funded as a state-federal partnership with the federal government paying a set percentage for all Medicaid services. This structure allows the federal funding of the system to sort of fluctuate with need. So if they're paying a set percentage of every sort of Medicaid dollar, if more individuals enter the Medicaid system, the federal dollars go up to support that. Or if we see sudden price increases or cost of care going up, again, the cost will fluctuate to meet that need. However, a lot of the proposals that we've seen over the summer, including, again, the proposal that came out today, they would include provisions that would really overhaul this funding structure. The changes that they would create would generally, these are predicted to lower the federal contribution for Medicaid programs over time, really in two ways. First, by lowering the funding that states receive if they've expanded Medicaid, so lowering the enhanced funding that's received for Medicaid expansion programs, and then more generally, placing caps, so called per capita caps or block grants, on the amount that the federal government pays for Medicaid services each year. And those caps, just so you know, would rise over time, but at a slower rate than actual cost of care. So that means that they're sort of predicted, it's predicted that the federal dollars going to states is going to be less over time than it would be under the current system. So what's the sort of takeaway from all that? Is really that over time, those types of proposals at this point are predicted to result in states having to shoulder more and more Medicaid costs as the years go by, which, as you can imagine, can put a strain on state budgets. And so many states are worried about these proposals because they know that if they see those strains on their budgets, they're either going to have to think about, do they then cut eligibility? So are they, potentially cutting who is eligible for Medicaid, or will they have to cut certain benefits to continue to make their programs sustainable? So again, protecting access to care from an affordability standpoint includes not only protecting access to care in our individual market with these subsidies, but it can also mean for many people protecting Medicaid funding so that the Medicaid program can continue to provide a robust set of services and be available to as many people who need it as possible. And then finally, given all these different factors, where do we sort of go from here? So one way to ensure that existing protections remain in place would be to move on, right, from repeal and replace proposals that so far have been sort of the biggest risk to a lot of these protections. So instead, Congress could move on, not continue the efforts to repeal and replace, and instead, as we said, there were some possibilities that Congress might be looking to even work together to create bipartisan support for legislation that could maybe address some of the ways that the ACA isn't working for some individuals. In particular, the legislature could seek to improve upon access to care in a couple of ways that different sort of policymakers and think tanks have been calling out in the last couple of months. So, for example, Congress appropriate funds to ensure those cost-sharing reduction subsidies continue to be provided. Just so you know, those have been sort of a critical issue over the last few months, as there was a lawsuit that put the funding for those reductions at risk. And so by appropriating funding for them, Congress could address that issue and eliminate it. Additionally, Congress could consider other ways that it could provide additional support for innovative approaches to affordability. So things you may have heard like reinsurance programs to address some of the costs for the really high-need, high-cost individuals. But again, keeping in mind that if we're going to move forward with programs like that, it's always still important to keep in mind protections on access to care. So making sure that while those programs could do a lot of good, that they're not being traded off for the elimination or undermining of protections that currently exist. So that should be a general overview of what's been happening, what's at stake, and if you've got any questions about those protections or what's going on at the moment, I'm happy to try and answer them. I think we're going to answer those at the end of the presentation. So write it down and hold on to it, and we'll definitely give a try at answering it at that point.
That's great. Thank you so very much, Katie, for this in-depth information. It really has been helpful to sort of walk through the steps of what we've witnessed as we were home watching the television, the debates and the votes that took place. This really helps to put it in the perspective. And for everyone back at home, we really just want you to receive this as background information, to educate you and to inform you on what is really happening currently with healthcare. Our call to action on September 28th, again, is simply to protect preventive services for the lung cancer community, and we just simply want to urge Congress to continue to work in a bipartisan way to improve health care with the strongest patient protections, and not just for us, but for all Americans. That's really the call to action there. So as you think about your meetings, I think it's important to consider, you know, how your day will flow and what it is that you need to convey to your representative. So let's think about September 28th, our Hill visit. So first, you should expect that you might be meeting with your members of Congress or their congressional staff. To the left are pictures of your members of Congress. They're so distinguished and they're eager and ready to hear from you. To the right are the staffers, and they look a little bit busy, chaotic, but truly they are the ones at work on your behalf. And what I want you to understand about Hill staffers is that they're not intimidating. Some of them can be educated and highly educated. Some of them can be different in how they relate to you in the meetings. Some of them may seem receptive or less engaged, but really, here are just a few things that you need to keep in mind. Age is typically between the 20s and up. They could be recent college grads to very advanced degrees. House staffers, meaning staffers who work for your House representative, will handle several policy issues. They tend to wear many different hats. They may include health education issues or much broader portfolio of issues. However, Senate staffers tend to specialize more in health and research-specific agencies, such as the National Institute of Health, Food and Drug Administration, CDC, etc. But one thing that you should know, they all tend to be connected to social media, and they're all very influential people. So if you're fortunate enough to meet with a congressional staffer, treat it the same as if you're meeting with the member of Congress, because they are very influential and they are the ones that will recommend action on your behalf. You should also expect to have a very brief meeting. Meetings can last anywhere between 15 to 30 minutes, and even though some can be 5 or 10 or an hour long, you should just plan to be brief in your meeting. Offices tend to be small, the space is limited, and you should know that September 28th, our day on the Hill, will be a session day, which really means that floor votes will be taking place. It is possible during your meeting, members will have to leave to go and take a vote. Committee hearings will also be taking place that day. So, and other meetings will be in progress. It will be a very busy day on Capitol Hill. Where the work is done can depend on what is happening in the office. Majority of the time, you should expect the meeting to take place in the member of Congress's office. If there's not the opportunity to meet there, it could be in the hallway, which is not, it's not informal. It is okay to meet in the hallway. Other times, you may be taken to a satellite office, particularly in the Senate. They tend to have large conference rooms where they will receive meetings. But either way, feel comfortable enough to hold a meeting in the office or in the hallway or wherever it is that they bring you and you gather there. One of the ways that you should approach your meeting is by thinking about a personal way of communicating with your member of Congress. Often I will share with people tips on how to hold a meeting, and one of the first set of advice I would like to give you is consider how you would approach talking to anyone about lung cancer, how you talk to your physicians. It is the information that you provide that educates and guides them in your care. It is like talking to an administrator. It is like talking to a friend or someone who is unaware about lung cancer. So if you look at this picture, it actually will help to demonstrate to you what it's like going into an office and what you need to do. So let's walk through a couple of tips. So number one, a few tips would be you want to be direct and concise when you begin to speak in the meeting. You want to be clear on what your ask is. You want to provide an advocate profile sheet that we will be developing for you. Many of you have heard from us. We've requested your pictures because we are developing an advocate profile that will contain your stories, a picture of you, facts and information about lung cancer, and as well as our ask. We also want you to take the time and in your own way to tell your story. Stories are very impactful. When sharing your stories and information, that is what will inspire the member and translate their support into action. You want to speak from your heart. You want to be able to give very specific examples about how lung cancer has impacted your life. You want to take turns speaking if you find that you are in a large group meeting. The point to all of this is to highlight your journey and to be able to tell your story. I want to encourage you to speak up, even if your voice shakes, even if you find that day you really are not able to have the pep in your voice as you would like to. Know that you being there, having traveled miles from home already speaks to how important your issue is, and your office will understand that. So speak up, even if your voice is shaky. In telling your story, back to my original point, you want to presume that the person knows nothing about lung cancer. You want to stay focused on your point. You want to be able to stay calm, no matter how emotionally driven you might be that day in recounting your journey and your steps. You want to be able to stay calm and tell your story. You want to be able to give honest and brief examples of how lung cancer has impacted your life and also your family. You want to include very specific examples, particularly if they are locally based, on who or what were supportive as compared to what wasn't. It's okay to talk about where you're currently seeking treatment, local centers or hospitals, or even oncologists that are your help and make up your care team. It is okay to share these kinds of details with your office. We want to ask you that you would return the favor as to be attentive and listen to them in the meeting. It is very important that you are confident in making your request. Know that you vote and you elect your representatives in office, and so you have every right to make a request of them. Be persistent in seeking their understanding, but not too aggressive. Often in times, we can sometimes grow to anger, and it's important to understand that anger will not bring about sympathy or understanding, but being confident in making your request and expecting support is okay. And then finally, I just want to remind you to remember that when you're talking to an individual, you are educating them. So this is an education mission, and that's what you are doing on September 28th. Use your voice, because your voice is a tool to promote understanding. If you would envision with me, this is what the room could look like when you're on Capitol Hill, and imagine yourself in that picture holding a meeting with your members of Congress and how you're going to share your journey, and you're going to be ready and prepared to speak out and represent the lung cancer community. I've said a lot, and so if you would allow me to, I just want to break down some of the tips that I just provided. So let's start with advocacy tip number 1, practice telling your story. And I also want to add to that, practice your smile, because it is possible when you arrive on Capitol Hill, we never know the circumstances. It is a fast-moving environment. You will have Capitol Police there who will offer direction and changes if anything unusual is taking place. But what you should know is from the start to the very end of your meeting, be courageous with a smile on your face, no matter how that meeting is going. So we want to invite you to, prior to your meeting at home, practice telling your story. We don't want you to read from a script, and you don't have to, because you already know your journey. We want you to be prepared. If there are specific facts that you want to share, look them up. Be prepared and know the facts for yourself. Be knowledgeable and trust in yourself. That's where that confidence comes in. Trust that you are the expert on lung cancer. And then what to do in those meetings. Come prepared by dressing professionally, but be comfortable. Wear your professional walking shoes. And then I want to add something to this. I would like everyone to think about bringing or wearing the color teal so that we can unite in teal to raise awareness for lung cancer. It should be said on September 28th, Lung Cancer Alliance is here. An Alliance for Lung Cancer is here to advocate for the community. We want to encourage you as best as possible to be on time. If you find that you are running late to and from a meeting, know that it is all right to use the telephone in the office if you don't have your own cell phone, to dial in and call the next appointment to let them know you're running a few minutes late. They will accommodate you. And then finally, the best advice is always to be yourself. We're not asking you to be an expert. We're not asking you to be a lobbyist. We're not asking you to be anyone other than who you are, because you are the expert. Advocacy tip number 2, It is very important that you speak as a constituent because members of Congress are bounded to those who elect them in office. It is important to keep the conversation local. That is why I encourage you to speak about what local entities or what local efforts are being done that helps you, that makes up your support system, or if there's lack of that as well. We want to ask you to please be sure when you walk into the office that you identify yourself as a constituent. Make your presentation short, to the point, and always factually based. Some of you will find yourself in large group meetings. If that is the case, we will identify in advance a leader, a group leader. That group leader will then take charge of being able to introduce the group and start the conversation and invite you to share your personal story. That's really the job of a group leader. If you forget to make the ask, the group leader will come behind you and make the ask. If you forget to leave your advocate profile, that group leader will come behind you and share that profile and just remind you of what to do. That group leader will be there to offer support. There will be cases where you might be the group leader, and that is simply what we're asking you to do, is to make sure that you're able to introduce yourself and start the conversation, start the meeting by simply sharing your information and leaving behind our profile sheet of you. So in the group, take turns speaking and be sure to identify the group leader. In terms of what to do, we want you to remember to emphasize that you are speaking for yourself and other constituents. It is very powerful to make the case that you are not only here for yourself, but you are here for others who unfortunately could not make the travel to Washington, D.C. So you're here to represent the countless Americans that are back at home with lung cancer. After telling your story, you must be willing to make an ask. Ask for a commitment to support you and your issues. Tip number 3, again, re-emphasizing telling your story. Just tell it. It really puts a face with the issue. It helps the legislator to relate specifically to the journeys of someone who has lung cancer. Relate facts and data to the impact that lung cancer has on you and your family. They must understand what it's like to live with lung cancer. There's different perspectives you offer as a patient, as a survivor, as a caregiver, and family and friends. Relate personal stories to policy issues. We've already articulated the need to advocate for improving our healthcare system to support lung cancer and early detection in lung cancer. There are other issues, too, that we will ask you to weigh in on. What to do? Always to speak politely so that the conversation continues. Mention that you care about research funding. That's another issue among access to care and lung cancer preventive screening. You care deeply about research so that more investment is made into lung cancer. Tip number 4, we want to encourage you to leave information and follow up on your meeting. When you're holding your meeting, remember that you're educating Congress on lung cancer. You will leave behind your advocate profile sheet that Lung Cancer Alliance is developing for you. And in fact, you should know that we are developing an advocate profile and a packet that is just for you to have. That packet will contain all the support materials that you need. It will have a full attendees list so you'll know who is in your meeting. It will contain a complete schedule of all of your appointments and the times and the contact number for each office. It will also include a map of the Capitol so you know how to navigate yourself. It will have our congressional ask so that you're reminded of what the issues are. We will support you every step of the way. Those will be provided to you. We will provide the information when you register and arrive at the summit site. So we just want you to feel comfortable knowing that you do not have to worry about a lot of this information right now. This is simply a training to allow you to think more about how you want to hold your meetings, what information you want to convey to your members of Congress, and how best to start preparing yourself. So again, back to tip number 4 and how you want to leave information behind and follow up. You want to leave your information behind. You want to take notes on what you've discussed and to share information with LCA on your meetings and how things went. Always leave the office thanking them. Be sure to invite the staff to attend a congressional reception. We will conclude our National Advocacy Summit with a reception that is held in your honor, and this is an opportunity to hold a meeting and invite staffers to come and socialize with you in an informal setting. And it's also a way to thank them for their time, their interest, and the support that is to come following your meeting. So what to do? Make your request for support, collect staff business cards, and those cards will help you to remember who you met with and how to contact them, because they will provide you with their email information so that later when you go home, you're able to thank them. During your meeting, we actually want you to take a photo with whoever it is that you meet with. It could be the member, it could be the staff, and if you find that no one's available to take a picture with you, we still ask that you take the photo yourself so that later you can follow up with a thank you, whether it's on social media or with a note to that office. Then I just want to let you know that when you follow up, the importance of following up in writing is crucial to having the meeting, because it then reminds them that their help is still needed and that you're expecting support. Bottom line, your voice counts, people. I really want you to know it is about people power. Your voice counts, so we just want you to keep calm and let your voice be heard. If you were to envision what your meeting is like, think about that photo with everyone in the room, what you do when you walk in the room, and you would just think about what that elevator speech is. So here's what I recommend. You want to walk into an office. You want to be able to say, good afternoon. Thank you for meeting with me today. My name is Elridge Proctor, and I am someone who lost a loved one to lung cancer. Today I'm here as an advocate with Lung Cancer Alliance, whose mission is saving lives and advancing research for lung cancer to eradicate this leading cause of cancer death. And your help and support is needed. This is why I'm here today. And then you proceed to tell them your story and to educate them on the importance of treating lung cancer fairly, compassionately, and most importantly, urgently. That's what you need to think about doing. Following this, after you have shared your personal story, you want to tie it to an ask. You want to be sure to ask them to join the bipartisan Congressional Lung Cancer Caucus to show their support. If any member says, we will support you, or we're with you, and they're preaching, and you feel like you're preaching to the choir, you need to ask them to please show your support by joining the caucus. Then you want to say to them, another way for you to help in a critical way is to approve increasing funding and support for cancer and specifically lung cancer research. Make sure you talk to them about lung cancer research funding. Third, you want to urge Congress to focus on improving health care with the strongest patient protection. We're not there to take sides. We are nonpartisan, but we all care about improving health care. And then finally, I am just excited and just very proud to be able to say that September 28th is going to be our day for Lung Cancer Till Thursday. So again, this is what it looks like. Senator Collins honored us by wearing our color teal, and we just want to encourage each and every single one of you, whether it's a scarf or a tie or a shirt or a blouse, whatever it might be, please think about wearing the color teal. So as we take a photo as a group, we'll be able to demonstrate our teal power on September 28th. We are nearing the conclusion of this presentation. However, we've saved some tips for you from our staff. September 28th will be our national call to action, and we just want to encourage you to bring your voice. That's what you're bringing from back home, your voice with you. This is our national call to action. So thank you so much. And right before we adjourn, we just want to introduce our staff. Chris Davis is going to now speak to you about local media, how to engage local media in this advocacy effort. I'll turn it over to Chris.
Hello, my name is Chris Davis, and I'm the Media Relations Manager with Lung Cancer Alliance. I wanted to briefly give you some details on the materials we're developing that will allow you to tell your story. The first one you see on the screen, Elridge already talked about briefly, the advocate profiles, and we're creating these as leave-behind pieces for your congressional meetings. They're going to include background on your own journey, taken from the registration information, along with the photo that you're providing to us. I'm going to include your contact information, what we're advocating for, aka the asks, national statistics on lung cancer, as well as state-specific stats for each and every one of you. And lastly, some background information on LCA. And just one last reminder, if you haven't sent along a photo to us, please do so we can make sure to include it with your own profile. When you're at home, before you actually come to DC, there is something else that you can do as well. Consider doing a letter to the editor. We're going to be providing a template for you to use, something that you can customize to personalize, add your own story to it, and just submit it to your local paper. Really easy to do. You can check online for submission details. Most papers have them readily available. You just have to pay attention to word limits and other guidelines as you craft your own version. Last year we had close to 20 letters placed nationwide, and we definitely want to increase that this year. So consider doing that. Just a key takeaway element with letters, not all letters will get published, but localizing it with your story will increase the chance that it will be considered. The bottom line is that local papers want to highlight what people are doing in their communities, and you coming to DC is a big deal, so chances are they're going to want to tell everybody else about that.
All right. Hi, everyone. Oh, sorry.
Go ahead, Gabby.
Hi, everyone. It's Gabby Geyer-Wright. I'm the Senior Manager of Digital Marketing and Graphic Design here at Lung Cancer Alliance, and I'm going to give you a brief overview of how using your social media channels will make a big difference while you're here in DC. So real quick, the hashtag that we're using for this event is Rally for Lung Cancer. Really simple, and it's really important to include that in your social media posts while you're here in DC. It allows you to be part of the larger conversation around lung cancer advocacy during that time, and it unites us all as one force. Also, like Elridge mentioned earlier, be sure to wear your teal to Capitol Hill so that we can really be a force on Capitol Hill together. And finally, don't forget to include photos in your social media posts, ideally ones of you with your members of Congress. We'll be handing out advocacy signs when you come to DC, like the one on the screen. And so we are going to encourage you to use those signs in the photos with members of Congress and staffers, and just as a way to reinforce our message. So with all that being said, I encourage you all to, if you don't already do so, follow us on social media. You'll see the handles on the screen right there for updates and news leading up to the event. So I'm really excited to announce that for the first year, we are doing a Lung Cancer Advocacy Action Week. And really what this is a virtual summit for friends, family, and other advocates who aren't able to make it to DC. So this week is going to land during the summit. It's going to be from September 25th to the 29th. And we've created a central web page that includes tips and tools to advocate from home, such as social media graphics that are shareable and easy ways for your friends and family at home to share their story with their state representative. And of course, we'll encourage them to use the event hashtag so that we're all aligned on that. So we'll send an email following this with details on the webpage and where you can find information, but you can also go to our homepage now and you'll be able to click through to the virtual summit that we have up, and you can take a look at that. So I encourage you all to share that with your friends and family, and if you have any questions about social media and getting it all ready before the summit, don't hesitate to contact Elridge and myself.
Thank you, Gabby, and thank you, Chris. So in addition to what they've said, we do want you to know that we've put together some links for online resources. When I provide you with a copy of the slides, you'll be able to click through each of these links and they will be live for you. So please check out these online resources so that you can learn more about Lung Cancer Alliance if this is your first time. We also will offer you facts and figures and more information to prepare you. We also want to ask that after this call that you would please give us your feedback by taking the survey. I will provide you with a link and I will send you a follow-up email so that we're in touch. We're now entering our question and answer session. We would again remind you to please click that left arrow pointing towards the left direction. It's on the far right corner of your screen, so that you can type any questions you may have. Again, if you're not able to do that, you can email policy@lungcanceralliance.org any additional questions that you have. Thank you. We'll just wait a few minutes as we prepare to read your questions.
Hi, everybody. This is Emily Ayers. I'm the Chief Operating Officer with Lung Cancer Alliance, and we have a few questions we're going to read out and answer for you. The first one is, prior to the Affordable Care Act, I was enrolled in a high-risk pool. Is this something that may be on the table with the ACA in jeopardy?
Hi, this is Katie Garfield. I'll take the first stab at this, but if anybody else wants to chime in, feel free. So in the high-risk pool, it is a possibility that we may see some states looking to high-risk pools again moving forward. This is something that assuming, as I said, that that the efforts to sort of repeal and replace, I guess that are not particularly, there's not a strong likelihood of them occurring given the short timeline through the end of September. However, what we may see is, as I was saying, you may see some bipartisan efforts to come together to create some pools of funding or things like that to try and address some of the issues that states have seen where they have higher than expected costs, and so that's where you're seeing in some states premiums becoming unaffordable, particularly for people in the individual market. So we know that ideas like high-risk pools and reinsurance may be something that states will explore on an individual level. Again, as I mentioned, that potentially through waivers. So I think it's an idea you may see coming around again. We would hope that it would be something that would get sort of built onto the current system and not undermine protection. So this is where, at the end, where I sort of mentioned, you know, we could see some helpful bipartisan things moving forward, but we would hope that those would build on the current system so it doesn't take away any of the protections that you currently have, but just hopefully improves upon affordability. So yes, you may see high-risk pools, but again, it's going to be about how are those implemented. So, and I think you're most likely to see that at the state level, so you're going to want to watch what are your state legislators doing? Are they continuing to sort of protect you if they're creating a high-risk pool situation?
Thanks, Katie. We're moving on to the next question.
So the next question, are there current lung cancer statistics available? Yes, there are. Those will be coming to you in a link to all those online resources. The latest, greatest facts and figures is part of that, but also the profile advocate sheets that we keep mentioning. They're front and back sheets that you will have in your packets when you register, when you arrive here in D.C. Those one-pagers will have not only information about you, but national lung cancer facts and figures, as well as state-specific facts and figures. So the next question is, what application is the @lca.org handle for? I know Facebook and Twitter accounts, but did not recognize the bottom one. Gabby, can you address that?
Yes, that's Instagram. And we will be mainly on Facebook and Twitter. During the event, specifically Twitter, but I encourage you to follow all of our accounts because they all offer different things. But for this particular event, Twitter is probably the most important.
Thanks, Gabby. Next one is, you're talking about group leaders. Will we not have Sherpas this year?
And to answer that question, we wanted to simplify for new as well as returning attendees. Group leaders and Sherpas simply mean the same thing. They have the same function. They will serve as your guide. They will help to guide you in the meetings. And so, yes, we are having group leaders who will take on the same function as Sherpas, but we wanted to be clear to everyone what a Sherpa is. Thank you. The next question rolls into the fact that someone's asking if they can visit another office where they have a tie to that office. So in this particular climate, we feel that it's extremely important for you to meet with your own representative. That's where you will have the most impact. However, after meeting with your own representatives, if you would like to visit another office or do a drop-by visit because you're closely tied to another office, we welcome you to do so. A complete schedule will be provided to you.
So the next question is, how many states are represented and how many advocates will be attending this year's summit?
Okay, great. So we have actually more than half of the country represented, just about 30 states represented for this year's summit. And in terms of advocates, we have, we're just under 100 in terms of advocates, but we are approaching, I would say, over 130 meetings is what we have a goal towards. And then just to give you a little bit more breakdown too, we do have over half of our group attendees are survivors, and we also are made up of caregivers as well as first-time attendees. So thank you. We're going to read some more questions. Next question is if I'll be sending over the PowerPoint. Yes, I will provide you with the slide along with a recording of this session so that you can review the tips that's been provided. Okay, someone's asking if we are going to have a place to secure your belongings. So essentially, we will have a luggage drop-off. We understand that some of you will be traveling back home that same day, and so we are coordinating to provide a luggage and storage place for you on site. Thank you for that question. Please allow us to read the next one. Okay, so we're approaching our last two questions that we're taking. This question has to do with logistics regarding the timing of your meetings. So the way that your schedule will flow is that on Wednesday, September 27th, you will arrive at the Omnishoram Hotel, which is downtown Washington, D.C., and we expect that you will register sometime between 1 and 2. After registration, we will gather together for what we're calling our general session, where we will then begin the conversation focused on research, advocacy, and our preparation for the next day. For that evening, we will have opportunities for you to meet and greet one another and to be able to find out who's coming from your state and how many of you will be joining together and who your group leaders will be. The next day, you will actually board the bus. We're providing transportation to and from Capitol Hill. We will then join together for a group photo at the U.S. Capitol. Then we will clear security and join in for a breakfast as a delegation. We will have breakfast together as one group. And I actually should mention that former Congressman Tony Coelho will be speaking with you, and he is going to share his personal story and words of encouragement for your Hill visit. Then we will begin our Capitol Hill meetings between 10:30 and 3 o'clock p.m. We hope to be able to accommodate everyone because everyone's at a different pace and a different stage in their care, and we do have a lot of first-time attendees. Therefore, to accommodate everyone as best as we can, we are allowing room within your schedule so that you can travel to and from offices, be able to stop and take the rest and use, the restrooms as you see fit and refresh yourself, and then also be able to take a break for lunch so that you're able to eat and be ready for your next set of meetings. Everyone will meet with their House representative and their 2 senators, and where we can, we will try to schedule additional meetings with state members from your delegation. Then we will come together and conclude our summit in the Congressional reception, where we will present some formal awards and acknowledge some distinguished honorees. And that really will conclude this National Advocacy Summit. There will be a bus that will pick up to take you back to the hotel, or you will have access to be able to transport yourself to where you might be going, whether it's the bus station, train station, or the airport. So thank you for that question. It allowed me to be able to share with you what your day will be like. And then finally, all other questions, really, you can email us at policy@lungcanceralliance.org. We're so sorry that we've run out of time. We want to be respectful of everyone's time. We're 15 minutes over, and I do apologize for any interference that we had during the call. And for anyone who had trouble and was unable to either follow or hear, we will be providing the links with the recording as well as a copy of my slides. I look forward to hearing from you. And thank you so much. Have a great night. And I just can't wait to meet all of you. Thank you again. You've been very gracious. Thank you.